Hi everyone, this is Dr. 𝗹𝗀𝗿 with Greenwich Chiropractic, and in this video series we've been talking a lot about elbow pain, and what we're going to talk about today are 3 very simple tests that you can do right at home to determine the cause of what's going on in your elbow and identify some of the areas that may be under some pressure or injury. Now, we know that as the months warm up, as we get more active, doing recreational things like playing tennis or golf or even doing yard work or gardening can be impacted by elbow pain, as well as those people out there, those of you who have physical jobs where you need the elbow to get the work done. So what we know is that the elbow, while it's complicated, has major conditions that happen more frequently. So we're going to talk about 2 main ones, and that would be lateral epicondylitis or medial epicondylitis. Lateral being tennis elbow, medial being golfer's elbow. So here are 3 very simple tests that you can do to identify 2 of these, and then we'll talk about the 3rd at the end. So the first test is for lateral epicondylitis or tennis elbow. What you're going to do is extend your arm straight out, bring your wrists up, and then with the opposite hand, you're going to apply some pressure while making sure that you keep your wrist in this position. If you feel increased pain over that lateral epicondyle, that lateral part of the elbow, this may be a clue that the tendons over the lateral epicondyle are inflamed, and this is causing something called tennis elbow. Now, just like we did for that test, the second test is very similar. It's just the opposite. So instead of having your hand flexed up, you're going to flex your wrist down, and you're actually going to be pulling up, trying to maintain that flexion or that bend in the wrist at the same time. So you're going to extend, pull, keep your wrist in the proper position. If you feel any pain on the inside of the elbow, that's a clue that you're experiencing medial epicondylitis or golfer's elbow. Now, if we think about some of the motions that we go through when we're doing those activities, it makes sense, right? As you golf and move through that motion, you can place a lot of stress and pressure on the elements on the inside of the elbow. And with tennis, especially with the backhand, you're going to place a lot of pressure on the outside of the elbow. So these 2 cases are obviously treated very differently. However, those 2 tests will tell you if it's one or the other, or at least give you some idea. Now, the 3rd test with some elbow pain can actually be due to a biceps tendon issue. And the biceps, we know, is what flexes the shoulder up. So any motion with carrying or lifting is going to be affected by this. But what you're going to do is place your palm on a flat surface, and then you're going to bring your hand all the way down and extend it. And if you're feeling pain right in the center, and you can feel that tendon, it's big, right? It's even kind of hard. If you're feeling any pain or discomfort in there, that could be a biceps issue. Whether it's just tendonitis or even so much as a full thickness tear, right? That would be when the bicep would even travel up the arm. You'd feel kind of a bulge here. That would be something that would require surgery. The other 3, while being very simple, are things that we can take care of in the office. We do this through gentle chiropractic manipulation to improve function and mobility, as well as customized therapeutic exercise programs to help get on top of the imbalance or the instability in the functionality of that elbow. So if any of these 3 tests created some discomfort, pain, or awareness for you, please come see us in our office. We'd be happy to do a careful consultation and evaluation. Thanks so much for listening. We'll see you on the next video.